The second group I'd like you to remember are the 9,310 Alabamians we lost this past year as we begin the new year. We now have lost 16,496 Alabamians to this disease since the beginning, including 41 deaths that were reported to us yesterday. So we unfortunately are not in a real good place right now. We are seeing the highest daily case numbers that we have seen since the pandemic began. Over the past 7 days, we've had numbers in the range of 8,000, 8,000, 7,000, 5,000, 4,000, 7,000 more yesterday. Several of those are actually records compared to what we have seen before last week. So these numbers are higher than we have ever seen before. All counties in the state of Alabama are in the red zone, in the highest level of transmission category. Our percent positivity rates is almost 39%. Almost 4 out of every 10 tests that are being done are returning to us as positive. Remember that we actually have no visibility on home antigen tests that people are doing. Those don't get reported to us, so undoubtedly there are a lot of tests out there being done, many of them probably positive, that we actually don't even know about. So we tend to think we're undercounting the number of cases that we've seen. Really the take-home point from what's going on right now is that the Omicron variant that is becoming the predominant variant in this country is incredibly contagious. It is much more contagious than the Delta variant. It is many times more contagious than anything we have seen before. Many orders of magnitude more contagious than the original strain that we had 2 years ago, almost 2 years ago. And it is just spreading like wildfire. It will infect everyone in this state at some point, probably, or most of them. So we really need people to do the single most important thing they can do to protect themselves, which is to be fully vaccinated and boosted when it's appropriate to do that. Being fully vaccinated and boosted seems to protect most people against serious illness or hospitalization or death. We don't have a lot of good numbers on that point yet because this is such a new variant. We just learned about it the last week of November. But to the best of our knowledge, from what we've seen in other countries and what we're seeing right now, vaccination remains the single most important tool we have to prevent serious illness or death. We are seeing spikes in our hospitalizations right now. We yesterday had over 1,100 hospitalizations. We were down around 300 just about 2 weeks ago, a little over 2 weeks ago. So we've increased threefold, almost fourfold in the past 2 weeks in terms of the number of people who are hospitalized. That's normally a very manageable number. 1,100 inpatients is a lot of people, but you know it's a third of where we've been at some points during the pandemic. Although I will say flu season is also going on, hospitals are dealing with that, and hospitals are dealing with unprecedented numbers of infected healthcare workers right now, either infected or in some cases just exposed. So it is creating some difficulty for our hospitals simply because they have many of their healthcare workers who are just not able to work right now because of the infectiousness of Omicron. It's a very challenging situation. We have seen some data from the UK and other places that you've probably read about that suggest that Omicron causes somewhat less serious illness overall than the Delta variant. That we think that's probably true. That certainly would be good news if that turns out to be the case. The UK study that I just mentioned showed that it caused death about half as often as the Delta variant, so that would be terrific. Here in Alabama, our experience with Delta was that about 2% of all people died who were infected with that. If Omicron, if it is shown to be that, for example, maybe only 1% of people die with Omicron, that's still 10 times the rate of what we see people with influenza dying from. It's still, tenfold more dangerous than influenza. And even if it's half as deadly, if you have a variant that infects twice as many people, you can see your numbers turn out to be the same. You still have the same issues with a surge affecting your hospitals and numbers of people getting sick or dying. We certainly hope that it is less serious overall, and maybe that'll prove to be true at some point. I want to mention Finally, I'll just say we think probably most of the variants that are circulating now are Omicron. It's really difficult to prove that at the moment, just given the relatively low amount of genomic sequencing that's going on. We do have several places doing sequencing. Our state lab is doing it. Several other labs in the state are doing it. Several national labs accept samples and do that in Alabama, as well as CDC continuing to do their sequencing. So we do have a lot of data points, but overall the numbers are still kind of small, given that Omicron has only been identified just about 5 weeks ago. But internationally, we've seen Omicron tends to replace Delta pretty quickly. That certainly happened in South Africa. It's almost happened in the UK. We are seeing in the northeastern U.S., and Omicron has become the predominant variant pretty quickly. So we believe, just given this sudden surge, including breakthrough cases that are happening, that we probably have a different variant out there. So certainly Omicron is the likely candidate, and we think most of the cases we're seeing now are Omicron. We'll have enough data to say that in the next 2 or 3 weeks, I think. Let me mention vaccinations again. That continues to be our primary tool. We've had about 2.7 million people who received 1 or more doses. That puts us about 45th in the country. That's not nearly good enough. Over 2.2 million people are completely vaccinated. That puts us ahead only of about 3 other states, 2 or 3 other states, and again, that's not nearly as good as we would like. We are seeing a lot of people who are getting booster doses. Almost 600,000 additional doses have been given. Third doses have been given. Some of those may be primary course third doses for immune-compromised people, but I think almost all those are booster doses. So we are seeing a good uptake among booster doses. But again, we still have a long way to go to be where we want to be. The best states in America, have vaccinated over 85% of the people with at least 1 shot, some approaching 90%, and we're just over half of people have had at least 1 shot in our state, so we have a long way to go. I wanted to take a minute just to talk to you about the change in CDC quarantine and isolation guidance that's come out sort of in dribs and drabs over the past 2 or 3 weeks. It's actually been really confusing to a lot of people. We've had a lot of questions asked about it, and we've had questions, in fact, that we haven't been able to answer because we're still awaiting guidance in some cases. But generally speaking, what CDC has said is that people who have tested positive for COVID, who are getting better and don't have fever or who don't have any symptoms at all, by day 5 can consider going back into public as long as they can wear a mask for an additional 5 days. There are a number of caveats around that. It certainly is a good idea for those people to get tested, although CDC so far has stopped short of saying they have to have a test to come out of isolation at 5 days. They've said specifically that this applies to the general population, but does not apply to schools. It does not apply to healthcare facilities. It does not apply to other congregate settings. They are working on additional specific guidance for those groups. The number 1 priority they have told us, is getting out new school guidance. I know many schools have called us about the fact that they've seen this 5-day quarantine rule and think that should apply to schools, and it does not. We have tried to put out statements on our website referring people to our toolkit, our school toolkit. Our guidance for schools has not changed. We continue to recommend universal masking in K through 12 schools. We are still encouraging everyone to follow exactly the same guidance that we have been doing all along. Nothing has changed with regard to what we're saying to schools. As soon as we get additional guidance from CDC, we'll certainly review that and presumably adopt that as soon as we have the ability to do that.